Hey everyone, I got a statement made to me this week in the office, and I get it sometimes, but the person said, "Oh, you're just a chiropractor. You're against all drugs and surgery." I want to let you know that couldn't be farther from the truth. I am not against all drugs and surgery. Remember, my dad's a pharmacist. I grew up in a very medical background, and there are uses for drugs and surgery depending upon the situation. If I cut my arm off, I guarantee you I'm going to be in the hospital getting it sewn back on by somebody who knows what they're doing and taking lots of drugs to keep the pain away. However, I'm against unnecessary drugs and surgeries, and that's a big, big thing because a lot of the things that go on nowadays are unnecessary. The overusage of antibiotics have led to so many infections now and bugs that they can't kill. And it continues to go on. I see it every single day. No matter how many times the American Academy of Pediatrics says don't use antibiotics for ear infections, doctors continue to prescribe antibiotics for ear infections, which if you've ever seen a kid on antibiotics, they are sick all the time because they never develop their own immune system. The antibiotic doesn't kill viruses, which most ear infections are, and a lot of the infections that we get from colds and flus, that people go to the doctor and they automatically get written a prescription for an antibiotic. It's not good for you. That's what I'm against. I'm not against drugs that are necessary. I'm not against insulin for diabetes. However, how many type 2 diabetics could control their diabetes by changing their diet and losing weight? We eat ourselves into that disease, guys. All I'm saying is, when I have patients that come in and I ask them to give me a list of the medications they're on, and many of them give me a list that's 8 or 9 prescriptions long, or some I've even had are 13 or 14 prescriptions long, I just don't believe all those medications are necessary. And those people wonder why they don't feel good. There are no drugs that don't have side effects, folks. And I hate the term side effects because they're not really side effects. That minimizes it. They're all effects of the drugs, whether they're side effects or the effect that the doctor wants. So all I'm saying is let's keep ourselves healthy. Let's not take unnecessary prescription medications or unnecessary over-the-counter medications as far as that goes. They're all dangerous, everyone. We can do a lot better, I guarantee it. So let's keep ourselves healthy. Let's do the right things. Let's try to minimize the amount of drugs that we take. And let's try to have a great, great, healthy life. Anyways, I hope this clears up some of the misconceptions about the way I think, because like I said, it's the unnecessary drugs, it's the unnecessary surgeries that I'm against. So have a great evening. I'll talk to you again later.